welcome to our YouTube series today, and we have no other but our Chair of BAPO, Nicky Eddison. And Nicky, why do everybody calls you Nicky? Nicky's not your full name, is it?
No, but it's what I prefer. So yeah, it just feels a bit formal. So my name is Nicky, and I'm the Chair of BAPO. I'm also a consultant orthotist at the Royal Wolverhampton NHS Trust. I'm also the orthotic service manager there, and I'm an associate professor at Staffordshire University.
So today we're going to be talking about a career in prosthetics and orthotics, and basically give everyone who will be listening to this a video, a kind of insight as to what goes on within the profession and how we can advance through the four pillars of practice. So with that being said, let's start with the foundation of what P&O practice is like. So could you explain what the four pillars of practice are, and how they work to shape our profession?
Yeah, I think it's really important that we understand the four pillars of practice, and to understand that professional practice is underpinned by the four pillars of education, clinical, leadership, and research. But we do need to bear in mind that the terminology used for the four pillars does differ across the four nations. So in our recent BAPO publication, we've been mindful to choose terminology which is inclusive of the terms used across the four nations. So you'll see that throughout the assets that we published in March of this year. But essentially, the clinical pillar refers to knowledge, skills and behaviours needed to provide effective and patient-centred prosthetic and orthotic care. The education pillar refers to knowledge, skills and behaviours needed to enable effective learning in the workplace. The leadership pillar refers to knowledge, skills and behaviours needed to lead and fulfil management responsibilities. And the research pillar refers to knowledge, skills and behaviours needed to use evidence to inform practice and improve services. So in essence, that's what they mean, but you might see some slight variations. It's also worth noting that NHS England have recently published a guide on pre-preceptorship and preceptorship. So that precedes enhanced roles. I think the importance there is to understand that at foundation level, which follows preceptorship, it involves learning opportunities across the four pillars of practice in order to enhance career opportunities. So right from the very start, we need to be embracing the four pillars of practice. And then if we go on and we work at advanced level, which don't forget includes enhanced practice, which usually means the first 3 to 5 years of practice, you need to be working across all four pillars of practice. It's also important for career diversity to ensure prosthetists and orthotists have a rich and rewarding career. To have that, they need opportunities to work across those four pillars. I think historically in P&O, we've heavily focused on the clinical pillar.
Yeah.
So it'd be great to see more prosthetists and orthotists in more advanced roles, in research roles and in senior leadership roles. I think there's an education piece around understanding that the four pillars are not distinct. They complement each other.
Yeah.
There's a really good blog by Jo Watson where she discusses the language around the four pillars of practice. She uses an analogy of a rope, which I like. So you've got these four strands and together they make a rope, which makes it stronger. And I think she's onto something there. I really do agree with her in that I think there may be historically we've looked at these four pillars as so distinct that you're going down either one or the other.
Yeah.
But when you think of it, when you think of research and the HCPC standards of proficiency, which we all sign up to, that says that we will now be able to evidence the fact that we're incorporating research in our practice. It's not distinct to the clinical pillar, because in order to treat clinically, you need to understand the evidence around what you're treating on. So evidence-based practice, differential diagnosis, that's all a certain level of research. It's the same with leadership. In terms of leadership, it can be around how you communicate with the patient, how you navigate a challenging situation. So they are interwoven. So I think it'd be worth giving a read of Joe Watson's blog to get an understanding of that, and also the BAPO assets that we've recently produced as well.
I was just going to go backtrack a bit. So there are lots of words you've used. You talked about pre-preceptorship and preceptorship, and some people might not really understand how that is. So could you briefly explain that? Also, how does this link in with someone who is just fresh into the profession, and why should they bother about the 4 pillars of practice?
Well, there's a document that's just been published by NHS England that lays out the terminology around pre-preceptorship, preceptorship, and foundation. And we've also published our own document around preceptorship. Essentially, pre-preceptorship is getting somebody ready for the transition from education into the workplace. Then you have preceptorship, which is the period between being that new graduate and understanding the workplace and what's expected, and all the things that go to a new place of work. And that might not just be for a new graduate, that can be for somebody coming from overseas to work in a different country, or it can be somebody coming back from a period of not practicing. So they would all require a level of preceptorship, and it really does have to be individually tailored to what the individual needs. And then you've got that foundation element, which is where you're really coming to terms of what the role is, and you're using those 4 pillars, and you're really building on those. And then you move into what the umbrella term is advanced practice, where you have the enhanced roles, the specialist roles, and the consultant roles. And again, we've devised a document which is P&O specific, which explains fully what each role means to prosthetics and orthotics.
Should every newly qualified prosthetist orthotist look forward to advancing their career, advancing their clinical practice? Should they be looking forward to being in enhanced roles? What would you advise in those scenarios?
I think it's individual to each person and which way they want their career to go. I think we all should be working across the 4 pillars, but how much you're building on those pillars will be different for each person. You have to have an understanding of all the pillars, and you have to be able to evidence that you're working in them all, but you may have a career direction that wants to take you very much down the research role or into leadership and management. It's individual to the person. So I don't think there's one career pathway that I would advise anybody take. It's individual, but again, we do have a document that outlines career development, and it's got lots of information in there about what you would need for each level of practice, or for which way you wanted to go in your career, and how you would build those dividends depending on what you need. And it does that in a really individualized way. So you'd look at those things and think which way you want your career to go, and that would guide you into which dividends you would need to build in order to try and realize what it is you're trying to achieve. But I do think there's an element of, from a wider P&O perspective, of opening up those pathways for people to do that. I think we need to understand that there are barriers there. If we look at how many advanced practitioners we have in P&O, it's far too small. So there are clearly barriers there for people, and there's an education piece around what it means to be an advanced practitioner, and that's why we did that project, and why we published that piece of work, and why we're building on it again this year. Because I think there's some misinformation out there. There was something recently that came up where a member had said they didn't think they could be an advanced practitioner because they don't have prescribing rights. But prescribing rights is not a level of practice, it's a task within practice. And you don't need to have prescribing rights to go into advanced roles. So there's an education piece around that as well.
So just to give a more visual perspective of what this might actually look like, what would a the different pathways. So the clinical bit, the education bit, the leadership bit, the research bit, what does that actually look like in reality?
It depends. It depends what kind of role you want to go for. Research isn't a distinct role. It's a part of a role. It can be something like a clinical academic role. It can be purely academic in a higher education institute. It can be lots of different things. And I think that's probably what we need to understand as a profession, that these pillars and these career opportunities, they can be lots of different things. And I think that's probably where we haven't got that balance right in prosthetics and orthotics, by solely focusing on the clinical side, that we probably think that if we're going to go into a research career, that means we have to leave clinical behind, or that it doesn't include leadership. Every role includes all four pillars.
Yeah.
It's just that they're stacked higher in certain roles. So obviously, if you're going into a role that focuses heavy on delivering research or embedding research within an organization, then the research pillar is going to be heavily stacked.
Yeah.
But you're still going to have to be able to have the skills across the other pillars as well.
Sure.
But I think you touched on something earlier around the challenges that new graduates are facing. And I think we can look at the recent data from our workforce review and the early years attrition data from HCPC that showed that prosthetists and orthotists in their first 4 years of practice are leaving the profession at a higher rate than all the other allied health professions. So that was 1 in 8, which equates to 12.5%, which is a significant number. And when we compare that to paramedics, who have an attrition rate of 1 in 56, which equates to about 1.8%, that is a significantly different picture. We also know that the younger generations have different expectations in their careers and from their employers, and they're more willing to change their career 2 or 3 times if it doesn't suit their needs. So if we look at the workforce review data, we know that our current students and our new graduates told us that they want to work as advanced clinical practitioners. That was 39% of them told us that. But we only have, as I've just said, three people in advanced clinical practice roles. Now, when I say that, I mean 3 people that would meet the criteria set out by the NHS England framework. So whereby enhanced roles will be you've become proficient in, you know, the basic skills of the profession.
Yeah.
Advanced role would mean that you're working at a master's level or you have a master's level qualification. And consultant level would mean you are working at doctoral level and have a PhD or you're working towards them. So in terms of that framework, we have 3. Yet we also know that 39% of our new workforce that are going to be coming in to P&L want to be advanced clinical practitioners. So we're going to have to change that landscape somehow to meet their needs.
True. Yeah.
And we also know that 25% of them told us that they want to work towards a PhD level qualification. So again, we need to create those opportunities within the workforce to allow them to do that.
Yeah.
So to do that, we need to understand the barriers from our current workforce for why that's not happening.
Yeah. And so now that you've said that only 3 people, and this is basically out of almost 1,000 plus prosthetist orthotists across the country, that are working in advanced practice roles, I understand that within your role, you are able to cover all the 4 pillars of practice. So does that put you in an advanced practice level? Or would you still require every other thing that is stated within the framework to be called advanced clinical practitioner?
I think the easiest answer to that is to ask people to read the advanced practice document that we publish, because within that we outline case studies that are P&O specific. So my case study is in there, Nick Galogel is in there, Laura Barr's in there, Conor McCabe. So you can have a look at those and see kind of what we have done. But that doesn't mean that's what you have to do. It's just an example. And it's also an example of what can be achieved. But I think the real crux of the conversation here is I don't want to speak for the others, but certainly from my experience, it feels like my role has been achieved through pushing and removing barriers. It's not been an easy path.
Can you
And
give
so
us
for the
examples of how you did that? Yeah, but we'd like to
well,
hear. Yeah.
well, for example, starting my PhD, at the time when I went to do a PhD and asked for some support to do that in my organisation, there was a lack of understanding of why would an orthotist need a PhD? Well, you know, how would that bring any merit to the service whatsoever? So then I ended up doing it in my own time as well as working full time. Now, if we're going to support our profession, that's an unfair ask. If we want people to move into advanced roles, we need to be able to support them to do that. And we need to understand what the organisation, whether that be NHS or private, is going to get from them doing that. And we should be very easily able to evidence that. And I think if we're now in a position to do that, it makes it easier for other people asking for that time and asking for that support to get it.
Yeah.
And I think there's some of the barriers that we need to break down. I think there's a whole piece around education and training. So in our current project, we do have Kay Pennell, who is leading on the education and training within contracts. And one of the things we're looking to do is to ensure that the education and training of our prosthetist and orthotist is embedded within the contracts for the services. And it's not solely focused on clinical activity, because if we do that, we forget that there are people there that require progression, support, who have aspirations to do lots of different things with their career, and it can be very easily overlooked. And that's why we need to embed that to protect them and to protect the future workforce.
And then moving on to the other side of our profession are the technicians and support workers. Now, I know there's a large piece of work around support workforce, and I'm just wondering, where are we as a profession when it comes to technicians and support workers?
The first thing to say is technicians and support workers play a vital role in delivering P&O services. And the workforce review for the first time allowed us to estimate the size of our support workforce. So we now know that there are around 870 plus support staff in the UK P&O workforce. So that equated to around about 820 technicians and I think it was 58 support workers. So the technical workforce is almost as big as the clinical workforce. So we know they play a pivotal role, but we also know that we still need more to meet the WHO standards. And we also know that from the technical workforce, in terms of the age range, we have a risk that there's a significant portion that are going to retire in the not so distant future. So there's that risk there. In terms of the support workforce, if we differentiate between technicians and support workers and concentrate on support workers,
what's the definition of both of them so we can be able to differentiate that?
Well, this is something that we discussed at length, and you was there, Krista, in the project board meetings, and I don't think we agreed on what that definition should be. And I think that is because we have to be sure that our technical staff see themselves as support workers. And in terms of support workers, if we did produce a document that outlines a support worker framework for prosthetic and orthotic workforce, and we also know that NHS England or Health Education England, that they were at the time, produced the support worker framework. So they're quite defined roles now, and P&O should be following those roles and that terminology. But in terms of support workforce in the support worker, what I'm referring to here is those that are based in clinic, that will assist the prosthetist and orthotist within the clinical duties and take up on some of that caseload themselves, rather than the technical workforce that may be, not all of them, but the majority of them will be working in a workshop and potentially off-site or in a different area to the clinical staff. So that's kind of how I'm differentiating. But what we do know is, in terms of support workers, we are behind the other allied health professions in embedding them within our services. But there are some great examples of how support workers have been utilised in P&O. So I know that Jane Dewsbury at Oswestry and Alison Stenson in Sheffield have successfully integrated support staff into their services. And there are other examples as well. And I know that Alison has presented on the support work staff in her service at BAPO's conference and at ISPO conference. And she's also working with us on the next iteration of the support worker guidance that we're currently developing. So I think this is a really exciting time for us to embrace the support workforce, also to also reduce some of the workload on the professional workforce. And create those roles for other people to be able to support the services that we deliver.
And potentially that could also help with advanced and enhanced practice as well, because if you have people taking on the workload of the professionals, then there's more time for them to actually develop themselves in other areas that are necessary to advance their careers.
Exactly. And when we published the new appointment times for orthotics in the BAPO standard, one of the things we talked about is embracing and embedding support staff into services, as well as telehealth, but looking at new ways of organising a service to try and incorporate the new appointment standards, but also new ideas around what the service should look like and how it should be delivered.
So I think we're almost at the end of our conversation today, and we've talked about a lot of things. And I think, even though we haven't followed like a complete structure, but you can have an idea of what the profession looks like in terms of what it is like a career. And I just want to end with this. What would you say to an aspiring professional who is coming into P&O and is not very sure of what the prospects for them in the next 5 years would look like?
I think, and I can talk from my own experience here as well, prosthetics and orthotics has given me a really, really varied and a career that I'm proud of. It's given me those opportunities, and those opportunities still exist for people coming into the profession. And I think we're now creating pathways to make that easier for them to tread that career pathway. So there's exciting opportunities. We know from the workforce review that there are still things that we need to do to make that career pathway more varied and more supportive. We're aware of it, but as a professional body, we're working on it. We're doing a huge program of work at the moment that spans across 47 different projects across key areas like support workforce, preceptorship, education, academic, leadership, research. So we're working on all those things to try and make the profession richer in terms of variety, in terms of opportunities. And I think one of the things from that, if we take research, for example, we need to create a pathway for research in our profession. It's one of the things that we're quite poor at doing. And in order to do that, we're looking at creating a priority setting partnership, which for the first time would provide us with a focus of what the research needs are of the profession. And that would be co-created with clinicians, patients, carers and families, and our stakeholders. And what the important thing for that would be, if it's something we're able to do and we're looking into it at the moment, is it would open up a source of funding. And that's important. When we're having
Yeah.
conversations around career pathways, there is always an element of funding.
Yeah.
And specifically in terms of research, there's an ongoing call for applications for funding for research that has a priority setting partnership in place.
Mm.
And so that's why it's a really important goal of mine as the chair of BAPO to try and ensure we can develop that, to create those opportunities for our current workforce and also for the people that will be joining us in the future.
Fantastic. And as chair of BAPO, if someone wanted to get involved with all of these ongoing opportunities and streams of work, how do they get involved?
So we put a call out recently to ask for applications from BAPO members. Now, we took the decision that it would be BAPO members that would be including as a learning opportunity. So we've got to differentiate between this. This is the learning opportunity. This is the opportunity to come on board with the project leads, get involved with designing, scoping and delivering the project. Something that you can be proud of doing, put your name on the final assets, or you're fully acknowledged, and learn how these things are delivered. So that's the one aspect that's already out for BAPO members.
Yeah.
But we're also going to be doing a series of webinars, as you know, Krista, and focus groups and lots of ways to include all the stakeholders in the profession to ensure that their opinions are heard on these projects and that we have a diverse voice in all the projects that we do. So that isn't just for BAPO members, but there's two things just to differentiate from there. But there's an opportunity for everybody to get involved in these projects in one way or another.
Fantastic. Thank you so much, Nicky, for taking out the time today to answer all of my questions. And I hope that this conversation has been useful and has provided as much information as possible to anyone who will be watching it as well. So thank you very much.
Thank you, Krista. I've really enjoyed it.